Rehabilitative or habilitative? Guys, I'm going to put myself out there and say I made a mistake. It didn't affect anything with my patients getting what they needed. But when I was doing my prior authorizations after my evaluations for a few patients, my first few patients with this one company, insurance company, because I'm in network, I don't need to do a prior auth for speech evals. So I did the evals, but then you call up and you say, okay, I did this eval, these are my diagnosis codes, and I'm requesting this number of treatment sessions over a certain period. And they ask you a series of questions. Was this an accident related? Is this due to an accident or work related? Blah, 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 which doesn't affect the kid. Like, I'm doing pediatrics at the moment. So then the other questions, it's always no. And then there's other questions like, is this repetitive? Is this blah, blah, blah? Is this other? And when you ask them, what do you mean by that? Most of the time they don't know because they're just entering stuff in that you say. So just an FYI. But then they get to, are these services rehabilitative, habilitative, or I can't remember the other ones right now. So here's where I made a mistake. I said rehabilitative because it's like ingrained in my brain because I never bill. This is the first time I've billed as an individual like provider since I started some of my private practice work. And so all in my head through my career is rehab. So I said rehabilitative, which it's not. It's habilitative for the kids that I've been seeing. Sometimes kids can have rehabilitative therapy. So like if they had a stroke or they had an injury and they lost skills from that injury, then you can do rehabilitative therapy to try to regain those skills. But the kids that I've been working with and billing for with this company have all been habilitative. So anyway, as I said, they all got what they needed. But when I said rehabilitative, I only got 4 visits right off the bat. And then they send you have to send all your clinical documentation in. And then if it's good enough, they say, oh, yep, it's deemed medically necessary. And they give you all your visits. So far, I was given all the visits I asked for, pretty thorough, lengthy reports. So I think that was helpful. But then I learned what habilitative versus rehabilitative was. Habilitative is what I'm doing with these kids so far. So these are skills that we're going to be doing therapy, working on that they've never had before because they have certain diagnoses or they're delayed. And so it is habilitative. Well, guess what? The minute you say habilitative, they give you